The first thing that we're going to do today is we're going to talk about the Head Start mandate about children of the age 2, so from their 2nd birthday up, being required to wear masks in the classroom. So starting next week, Wednesday, all children, all students ages 2 and older will be required to wear masks while indoors. The only exception is when they're outside, when they're eating or napping. They may wear a disposable mask, a cloth mask. It needs to be a minimum of 1 to 2 layers if it's, 2 to 3 layers if it's a cloth mask, like a homemade mask. And the mask is required to cover their mouth and their nose at all times. It needs to be good fitting. So if it falls down below their nose like this, that isn't a good fit of mask. And just like adults, if that's happening, that mask should not be worn. We need to make sure that we're covering our nose and mouth at all times. So a couple of things that are going to be asked. Staff and student masks should be cleaned routinely, especially if they're cloth masks. If a mask is forgotten or soiled, classrooms will have masks available for replacing the soiled ones. We're going to send all of those masks out to you guys. Outlying areas, we're going to mail them to you because of obvious reasons right now with weather. So you will not implement this until you receive the masks. When assisting children with masks, you need to make sure that you either sanitize your hands, wash your hands afterwards. If a child is wearing a disposable mask and it falls on the floor, then you'll throw that mask away and you'll replace it with a new one. If it's cloth, then what you will need to do is you will put that in a baggie. You will put it with the child's belongings, just like anything else, or have the child put it with their belongings, and you will give them a disposable mask to wear for the rest of the day. We will be sending you guys Ziploc bags as well. Make sure you let the parent know that that mask needs to be cleaned before they wear it again, you know, that type of thing. Children need to have their masks on prior to entering the classroom when coming in from outside. So please make sure that children are putting on their masks before they come into the center when they arrive in the morning and things like that. When the kids are outside, I would recommend coming up with the only thing I can think of is a baggie system in a bin, where you put the kid's name on the baggie and you have them put their mask in it, and then you have a bin so that when they go outside, they can play, and then when they come back in, you put their mask back their mask, or they put it on, because the mask cannot touch. So if you have a whole bunch of children just throwing their masks somewhere, or if it's disposable, you can always just give them a new one. But it's the masks cannot touch each other. The children's masks cannot be on the table during mealtime. So again, I think your baggie system is your best way to go. And ideally, if somebody touches your mask, like if the child touches their mask or plays with it, like I'm doing now, we should be going and washing our hands. We as adults should be doing that, and ideally children should be doing that too. I understand that that is going to be near to impossible to implement, but just do your best. So if families need support and ask us accessing masks for their children, please let your social service FA know. Or if you're a CFA, work with the families. We have resources available to help them. And then, sorry, that's Bobby's stuff. And so we will be sending out disposable masks. We have some available. We purchased enough for the classrooms currently. So each classroom can at least get a box of them. Each box should have about 100 masks in them. And I realize that if you're doing 20 kids, that box will last you a week. So we really need to work with family. Crystal, you can't hear us? Can everybody else hear us? Okay. So Crystal, we're being recorded. I know you can't hear us. Albany, can you just put in the chat that we're recording if she can't hear? Okay. And that, so we'll make sure she'll get to see this. So I know this is not ideal news. I know this is something that is not fun, but this is a Head Start and OPK rule that has been issued. So we will be sending out letters to you guys either today or Monday to send home to families to prepare them for this change, to let you guys know what's going on, and we'll send you guys some of this guidance that I read off today. If you have any questions, please put it in the chat. And thank you for listening. And we know that this is really hard, and we know that this is going to be a challenge for us to implement. We are never going to, just like anything else we do, we are not going to force children to wear masks. We have modeled it by us wearing masks. We are going to encourage them to continue to wear their masks. And, you know, that's what we can do. Just like we don't force children to eat meals, we don't force children to take a nap, but we encourage them, we provide the opportunity for them, and we teach them and give them these opportunities to learn. So this will go into effect on Wednesday of next week. And so we will be sending everything out, Osley, very soon. So thank you guys. Again, continue to put your questions in the chat, and I'm going to hand it over to Bobby.
All right, good morning, everybody. Thank you for joining us. So we have a lot of material to cover. Let me minimize this. So let me see. I want to start out by making sure everybody has a child's file in front of them and that you have your Child Plus signed in and on your screen. Okay. We're going to use Johnny Test today as our sample. The way you can access Johnny is go to the search box in your Child Plus, and you can just type in Johnny's last name. And click on Johnny. All right, I'm going to give you a few minutes to do that. Is there any questions coming up on Johnny? Okay.
Do you want me to pull up the chat so you can see it?
I got it here.
She's got it. Yep. All right. So we're going to do a review. We're going to break it up component by component. It's a lot of information to take in. If you're feeling overwhelmed, that's all right. You know, save your questions, put them in the chat box. Your ed managers, your B5s, myself, your component directors, we will be able to help you guys with these files and with Child Plus as well. So we're going to, like I shared before, we're going to go over the child's file. I'm just going to quickly give you just a brief synopsis of the file. We're going to start with the spine of your file, which is right here. As you guys know, we all went out and did some file monitors, and so there were some pieces missing. And so the reason for this training today is we thought it would be helpful if everyone heard the same message, everybody got the same guidance, and hopefully we can answer any questions that you guys might have as well. So with the spine, you want to
Sorry,
sorry about that, guys. Technical difficulty in the room. So with your spine, you want to make sure that your spine label is complete and filled out. Okay. So our child's files are set up similar to our Child Plus. The tabs are in a little bit different order, but you will see how everything flows together when we go through this training. Let's see. I want to talk a little bit also about roles and responsibilities. So some of you are teachers, some of you are family advocates, and some of you are child family advocates. So part-day teachers who do social services. So if you're an enhanced day teacher or a CCP teacher or an early Head Start teacher, you and your family advocate, you guys are going to work closely together to make sure that these files are up to date and that Child Plus is up to date. So with being an enhanced day teacher, teachers don't have a lot of time to work on files. So what we tell our teachers is we want you, your main focus is you really need to, focus on your education component, right? Get everything documented into Johnny Test or under each child's name filed in Child Plus under education. The family advocate's primary role is to ensure that social services are done, that everything in the health component is done with the support of the teacher, with the support of the ed manager, all right? You and your family advocate are going to work together on the mental health piece. And if there's a kiddo that rises to the level that needs to be put on our ICS list, you guys will work together on that as well. In the enhanced model and in our early Head Start models, this is really important that the family advocate and that the teacher, that they're collaborating and that they're working together. Part of our data system, Child Plus, that we use is a communication tool between the teacher and between the family advocate. So we're going to talk about that at the end, about progress notes and what that's going to look like, right? So we're going to start with the enrollment section. I'm going to turn this over to Jesse. So on your Johnny Test, if you can have your application open, which is right here, and then in your child's file, start with the program face sheet. And then Jessie will run through the face sheet, what needs to be on that. And then she's going to start her piece on the enrollment.
Hi, everybody. Having a hard time finding.
Can everybody hear me okay?
What's wrong?
I do
Might need to go
Johnny
there.
Test. Okay. Might need to.
Can you type into her?
Almost there.
She's back. All right, if everyone can hear me, I'll go ahead and get started. So to start with the file, first we have the program face sheet. This sheet is filled out when the family advocate does the enrollment. It is filled out in pencil so that it can be updated throughout the year. So if an address changes, if a phone number changes, that information needs to be updated on the face sheet. That's why it's in pencil, so that it can be erased and updated. So we have the most current information on this face sheet. Everything needs to be filled out all the way to the bottom with the emergency contact and the emergency for treatment for illness or injury. So when this enrollment packet is handed to the teacher, when you're doing open house, if any of that is missing, please ask the parent so that you can add it to the face sheet.
Jesse, I'm sorry to stop you for a second. No one can find Johnny Test, and I'm wondering it's because they don't have access to everyone. Is there a different way for them?
I found it. I found Johnny Test.
Selma.
Yeah, because family advocates.
Yeah, family advocates, teachers. Isn't there an advanced search?
Yeah, so when their search bar
Yeah.
pops up, it's outside of my.
3 dots to the right of the search.
Do you want to give direction on that real quick?
Yeah, so if you
we
can't
are
find
doing
Johnny Test on the search, if you want click on those 3 dots to the right, it'll search and then you can search for him that way. Let me know if that works.
Do you want to show more of the dots on?
Well, I guess I was
Yeah.
using these 3 dots right here. And then
Thelma, I don't think they're muted.
I'm trying.
Yes, on their own Child Plus.
They can, I mean,
They can
they
just
can
follow
along
along.
by any child in their
Yeah.
class. Yeah, if you just pick a child from your class, that'll work the same. Just follow. along. All files. It's not just for this.
William Dennis or not.
All right. So any questions on the program face sheet?
No. Just throw them in the chat.
Oh,
We're gonna write them down for later. Just keep going, yep.
next, we have, so the enrollment section, this again, most of this section is completed at time of enrollment with the family advocate. And then, and then at the open house as well. So, the face sheet is set up in the order it should be in the file. So at the application, you should see that first, then your recruitment notes and eligibility verification. Which recruitment notes include the family's original application, eligibility, and recruitment notes printed from Child Plus. So that should be in the child's file. So if any of that is missing, please let your family advocate know. And then family advocates, when you send an enrollment packet to the teacher, that should be included in that initial enrollment packet. So when I say recruitment notes from Child Plus, this is what they look like. So this is what they look like. So you should see these in the child's file for every child. Okay. So, and then to the left, the lines, those should be the date that those, that paperwork was completed. So the date the application, the date the parent filled out the application, signed and dated, and then recruitment notes and eligibility. You'll find that on the eligibility verification form, the date that eligibility was determined. That's the date we want on that line. And then if you go down to the enrollment section, we're looking for the date the enrollment paperwork was completed. And then again, you're still following that order. So you see the application, the recruitment, and then you should see the emergency notification form, the release of information, and then the parent consent form. Next, you have placement paperwork, parenting plan, or restraining order. So obviously that's not going to apply to every child, but if that's in place for a child, it needs to go in the file in that order. And the date that that paperwork was received is the date we're looking for on that line. Next is first date of service. That is the day the child actually attended class. So when the enrollment packet is given to the teacher, that line is going to be blank because we don't know the child when the child will start yet. So the teacher really needs to make sure to go back to the file and add that date once attendance has been confirmed. Next is open house. So open house is the teacher schedules with the family and completes. And then same, it just goes in that order in the file. Parent partnership, family culture, interest survey, declaration of viewing, the advantage dental consent, KCI, and transportation. The dental consent might already have been filled out at time of enrollment. But the date on the line, we're looking at the date of the open house. So when that open house is completed, make sure to add that date to the file. And then the date of the CAPMP form, which is done at enrollment. And And the last piece to the enrollment face sheet is the intent to re-enroll, which is done at the end of the year. And again, just the date that you filled that out with this.
One thing to add is when you guys are working on your files, to treat your face sheets just like it's a table of contents. And so it needs to follow, the forms need to be in the order that's on your program face sheet. So it's reading just like a book.
And if you have a child in the program for multiple years and you're adding updated forms, the most up-to-date form goes in your
The back.
the back.
The back.
In the back.
Reads like a book.
Reads
Yes.
just like a book. So a first year, you have to have a kiddo that's been in the program for a couple of years. You're gonna see the first year in the front and then the second year in the back. So just like chapters in a book. All right.
Team, is that, just to clarify, that's also with the face sheets?
The
Or
face-
is the most recent face sheet in the front and then everything else behind it reads like a book?
Correct, Johnny. Thank you. Do you want to go over the enrollment section in Child Plus?
A little bit of how they review. So I guess for Child Plus, from the face sheet, we do upload things into Child Plus, such as the emergency notification form, release of information. If those forms are updated, they need to be sent to data entry, so the new and most updated form can be uploaded into Child Plus. And the enrollment section, you can find the information in the application tab in Child Plus and also in the enrollment tab. So in the application tab, I showed you where to find the recruitment notes. On family information, you see contact information, information about parents, house, anything with the family, living situation. Phone numbers are a little bit different. They did change in Child Plus. So some of our children that have been in the system for a while, you might see phone numbers and family information. But otherwise, if there's not a phone number here, you're gonna want to go to the adult, the primary adult, to find the family's phone number. This is over. Address for the whole family is in family information as well. And then over in the enrollment tab is where you find all the information about the child's eligibility, their enrollments, enrollment notes, any notes that were made during enrollment or recruitment, their eligibility when that was determined, and then any of the family's eligibility criteria are all, we call them risk factors as well. And teachers should be reviewing this before the child starts class. So, and then in enrollment notes, you guys are still wanting them to date stamp that they reviewed?
Yep.
Okay. So in enrollment notes, the teacher would date stamp that they reviewed the eligible or the enrollment tab and the child's information here. In notes. And then flags. We need to go to flags.
If you want to just let them know what the flags are,
Okay.
if you don't mind.
Yeah. All right. So another thing that we do to track different things in Child Plus is use our flags. So for children, you'll see these colored flags at the top, and they all mean something. So if you hover over them, you can kind of quickly see what they're referring to. What they're notifying us for that child. There's just an easy way to see kind of a little bit more about the child. If you click on flags here, it'll open up all the different flags that we use. And then you can see notes to kind of what the flag is being used for or when it was put in effect.
That's good. Yeah, you're good. All right. Okay, guys.
Yeah, they can't see me. Can everyone hear me? Yep. Okay, sounds like everyone can hear me. All right, I'm gonna go over the education piece. If you want to flip your file over to the education component. Just so everyone knows, we do have two different face sheets. We have a face sheet for early Head Start and we have a face sheet for Head Start for the education component. Top of your face sheet, you will see the child screenings and assessments. For now, ignore the ASQ SE. We no longer are doing that. We switched over to the EDECA section, so you can just cross those off on your face sheets. The next one down is your ASQ assessment. It's done at your first education home visit or in some cases at your open house. You would mark the day that it was completed, and then if they passed or if there's a potential concern. If there's a potential concern, then you write the area of concern. Once you've completed with this with the family and you're back at your desk, you sit down and you add an event into Child Plus. So you go into the education tab, add event, and ASQ. And it will look like this when completed. So the date that it was scheduled, the date that it happened, if they passed, for the description, you put the month of the ASQ, the results, and then the person responsible for doing it. And then down in the notes, you put any area of concern and then the plans to follow up on that ASQ. Up here, you put if there needs to be a referral or a follow-up assessment. The same thing goes for EDECA. At this time, use the ASQ SE event tab. I know that's a little confusing, and we're working with the Child Plus administrators. Sorry. And then after you added your events, then you go over into the education information tab. And down here's where you enter the scores. So your first ASQ goes here with the date, your scores. Ignore this. This is for the ASQ SE form that we no longer use. And then EDECA is over here. And the score should line up with the forms. I know for early Head Start, you do a lot more than 3 assessments for each of these. So when you add an event, just put the scores in that note section. The next section, you have your TS Gold checkpoints. There's nothing to do in Child Plus. Simply you just mark the date that you completed them for that child on your face sheet. The next session is the parent staff conference. You complete it with the family. You put it in your progress notes, your conversation and the conference, and then you add an event here for your first parent conference. Any of the notes from your conference should go into progress notes. Next, for Head Start, you have your kindergarten readiness scores. You just simply write them in on your face sheet and then file away your kindergarten readiness forms. For Early Head Start, you have your transition plan paperwork. So once you've completed that with the family, you will go up into enrollment in Child Plus and complete the Early Head Start transition plan. There is a lot of information on here that you will most likely get from a family advocate. If you don't know the information at the time, that's okay, just leave it blank. We just need the transition plan started. So Jesse can get on and look who's all on the transition plan at this time. Next, you have if there was any field trip permission forms, the date, and then you file it there. After that, you have your classroom attendance. Each month, at the end of the month, you go through and put how many days they were present, number of class days offered, and then the percentage that they were there. And then below that, you have your home visit, home base attendance. You do put the date that any home visits occurred. For home base families, this is mostly used, you will use a lot more of these spaces than just your average 3 home visits per year. And then the socializations, that is strictly for the home base model. And then below that, you have your attendance plan. So if they do go on an attendance plan, then you would mark the day that it started and then the days that it was reviewed and followed up, and just make a note that that's the date that you discussed that with the family. And those are also in Child Plus under attendance plan, add no attendance plan, and then you'd create it here.
We have Catherine doing attendance.
All right, guys, so we're gonna continue with attendance. We're gonna go up into your,
Do you want to sit over
no, you're
here?
okay. So there's the entry express, if you're still using your Child Plus. We're gonna enter attendance. Doesn't matter. I'm just gonna pick a classroom, guys. So for attendance, we want to just be sure that everybody's doing this the same way. So when you're entering attendance for Monday of this week, some of your classrooms, it starts out as closed. If that's the way it is and your class was open, you need to change that yourself just by clicking the tab and choosing whatever it needs to be for you. So if you were open, and then when you're looking at your kids there alphabetically, and we want to be putting the attendance in here just based on what you know for that day. And so if you have kids who are absent, we still have the policy where we want to be reaching out within the hour after class starts, so that you guys can check in with parents and have that conversation as to why they're absent. If you don't get a reason, that would be an unexcused absence. If you get a reason, you can put excused, and then there is another tab where we would like you to tell us why they were absent. In this, we have a couple of the codes we still are using for COVID. So you guys need to be sure you're using these codes so that we know why these kiddos are gone. If it's just a family excuse, they're just like, we just didn't bring them in today and that was their choice. You're gonna leave that under family. But the 2 COVID ones, we still want you to let us know if it's due to an exposure or due to actually testing positive for COVID and needing to quarantine. One of the things we discussed is if you're continuing to have parents give you the reason for COVID exposure the first time, we're not going to ask you guys to do attendance plans with that family. But if it's a reoccurring theme that they continue to use COVID exposure, for reasons of absence, we would like possibly like the next month, if they say that's happening again, we would like you to do an attendance plan with follow-up, and, you know, offering suggestions of not being exposed, basically, so that those kiddos can get in our centers and be getting services. Some of the other reasons they could be out, if exclusionary will come up next month, those kids who we are looking at for immunizations are excluded, and we want you to use that. If you have any in your classrooms, illness, if it's just a general illness, and then for classrooms, if we're closed due to weather, you can put that in there. Or one other one that we exclude from our attendance percentage is if we require a medical or dental appointment that does not affect their attendance percentage. So we just want to make sure that everybody's using this tab. When you're excusing a child, we need to know why. If they're present, you can just leave it on the present, and it'll still give you those totals of how many kids for that day, and then you just save it at the end. And for anyone wondering, we don't touch the breakfast, lunch. That's based on their CACFP. If that needs changing, we can do so with food service, anything like that. And then the last thing on attendance, guys, we want to make sure, we know it's a timely thing, but we ask that these are inputted by Friday every week, just so that we can look at it and see where our numbers are as far as attendees. Yes, I don't know where that is. In the attendance tab. Oh, in services, you're saying.
All right, so another thing for attendance and attendance plans, attendance plan follow-ups. We really need you guys to add this in Child Plus, so that way we can run reports at the end of the month and see which children are on attendance plans and how many attendance plans we have in place. If a child is missing more than 10% attendance or has 2 weeks of consecutive absences, we really need to be looking at doing an attendance plan. I know there are reasons why we wouldn't do an attendance plan if that was the case, such as if they are out because of COVID quarantine and we know that, or if they were pre-approved to be out for a month for a family trip, vacation kind of thing, which do need to be pre-approved, but things like that we might not put an attendance plan in place. But we really need to know when we're looking at attendance that there is an attendance plan in place or why there isn't one. So if you go to the attendance tab in Child Plus, and then down here where you can see the box for follow-ups, if you click on add follow-up, it'll create a line. In the follow-up column, click on the drop-down menu. You can click on attendance plan. Then you put your name in staff column. Completed, you would leave blank until the plan has been completed, and then notes, you can just type in
You're no
any
longer
notes.
sharing the screen.
Oh, I'm not. Oh, God. I'm sorry, guys. Let's see here. There we go. I'm sorry. Okay. All right, how about now? Good, okay. So attendance tab, down here in the follow-up box, you would click on this green add follow-up. It'll pop this line up here, and then you would just fill it out accordingly. If you're just adding a follow-up for attendance plan in notes, you can say something as simple as see attendance plan, because you're gonna put all of the details of the attendance plan here in the attendance plan tab. That's detailed and lined out with instructions there. Make sure the due date of the attendance plan when you're doing a follow-up matches what is on your attendance plan here. And then if you're doing any follow-up on your attendance plan, again, you can just add follow-up and say I did follow up. Or whatnot there. If a child is below that 10% or has consecutive absence and we're not putting an attendance plan in place, you would do the same thing, you would add follow-up, and then you would select no attendance plan. And then in the notes, you would give us the reasons why there's not an attendance plan in place. So at the end of every month or week or every 2 weeks, I would just pull your attendance and any of those kiddos that are below that 90%, you need to add the follow-up, either attendance plan or no attendance plan.
Okay, do you guys need a break? Are they okay to keep going?
Everyone shaking their head no. Oh, yes, I don't.
Yeah, someone said yes.
All right. Let's be back at, it's 9:44. Let's be back at 9:50.
back, you guys. You would deserve a little break. So I'm gonna talk about the health tab. So if you're following in your binder with your face sheet, the first thing is the certificate of immunization status. This will most often come from alert. And my understanding is we want you to keep all the copies in it. You don't need to replace old copies. And like they said before, reading it like a book. So the newest copy goes into the back. If you have a homeless family or a family coming from out of town and they don't have immunizations entered into alert, you can fill out the CIS as an electronic copy and then reach out to your health resource specialist or myself and we can help get those into alert. We just need a copy of their immunizations from wherever they got them. And there may be kids that are entering that don't have any, and that's okay too. The health history you get from the enrollment packet, medical alerts and allergies. We talked about this in our health forum Zoom. I'll get the link for that if you guys need a refresher on that. But those will go in this tab as well. I know several of you are waiting for training on protocols that you have in place, and I have contacted another nurse with the IMESD, and so that is coming. I appreciate your patience. I know it is frustrating with families, but we are really doing our best, and it has to be given by a nurse. So the vision screenings and hearing screenings, those, your health resource specialist comes into the classroom to perform those. And then their documentation is sent to the data entry specialist who enters it into this events tab under the health section. And that lets you know if they are referred or passed. If they are referred, like you'll see here, there is a plan to follow up and then this child passed. If they're referred several times, then a referral is created to get them into an audiologist or their primary care. So we follow up in that way. The nutrition assessment is no longer being done by WIC. They don't have the capacity to do that. So a nutrition assessment can be done by referring them to their PCP. But the fall heights and weights and the spring heights and weights are done by your health resource specialist. And they can tell by those numbers whether the child has a high BMI, in which then they would need to be referred to do that nutrition assessment. They don't need to be referred to nutrition assessment if they have a high BMI. Right, so not every child will have a nutrition assessment. It's only for those extremely high and extremely low BMIs, which we can tell from their height and weight assessment. The well child exams is something. The well child's exams is something I want to touch base on. Those would be under the health tab, but in attachments. So if you have a child that does not have a well child exam here, before reaching out to your health resource specialist, I want you to make sure that the ROI is up to date. So that they can even reach out to the PCPs to get a well child exam. And then also, lost my next thought.
You're doing good.
You were just saying, so get facts for it or like before reaching out to health.
Oh, I was gonna say that the well child exam is good for 1 year. So if your child got their well child exam May 30th, 2021, it is good until May 30th, 2022. So they're good for a full year. So you may not be getting one every year, and that's why a new one may be uploaded mid-year, depending on when they're actually due for one. Dental screenings. So the dental screening is done by Advantage Dental in the classroom. But the dental exam can only come from Advantage Dental or another dental provider when the exam is only done in the office. So I just want to be clear on those distinctions. And again, dental is also entered into the events tab with the results from the data entry specialist. And then also keeping track of when follow-up is made
Because that's really important for the FA or the CFA. If there's any like immediate dental needs, so that we can follow up on those. The lead screening, that form is a part of the enrollment packet, so that should be under this tab. And then we have the incident reports, medication administration authorizations. Those are all as they come up. So if they don't have any of those, then you don't need to worry about those. And then there's the health appointments and tracking. That sheet should be the last page in this tab. And that really keeps track of who their primary care provider is. We need to know as specific as you can. The site isn't always good enough, so if they go to Good Shepherd, we really need to know the provider. Especially if they're out of town, we need to know more than Boise, Idaho. We need to know if they can get the provider so that we can fax for immunizations and well childhood. Yes, at minimum, the name of the clinic, but if they know the other information, it is super helpful to our staff.
Sarah, did you do the 30-day determination? Oh, no, where's that? It's right before.
Yes. Well, whoever has to do it, it has to be our doer. We'll find a date. Yeah. Yeah. And then position the address.
Go ahead and just speak to it, just.
Yeah. On H6, the 30-day determination, medical home, dental home. You do need to write the date in there. You can find that date in Child Plus in the events. Health will enter that when they determine that the child has an established primary. So just be looking in Child Plus so that you can record that date.
And that date might be in the previous year because of the well child exam is a calendar year. So you may have to look in the previous year to get that determination date.
So I know a lot of you are working really hard on getting these files in order. So that's why we wanted to show you where these things are at in Child Plus before reaching out to your health resource specialist. Of course, reach out to them as things are missing, but also be patient. They are getting a lot of requests for things that are in Child Plus. Yes, and so then backing up a little bit with the well child exams is this year we've implemented a cover sheet. So you don't necessarily have to go through the whole well child exam. The health resource specialists are doing that for you by providing the cover sheet, and that has the determination date and also key points that need to be addressed with the family. So whether they're missing certain components or there's concerns, these items are meant to be followed up on and discussed at the home visit. Anything else?
That's good. The one thing I want to elaborate on again is the teamwork between the family advocate and the teacher for our enhanced aid programs and our early Head Start programs. You guys really need to be working together and communicating on this. So although the health component, it's heavily the family advocate's responsibility, it's really important for you as the teacher to take a peek at those well child exams and use the cheat sheet now that the health team is providing. Oftentimes when a kiddo does their well child exam, the doctors will administer the ASQ, just like what we do. And it can be helpful to use, like if the doctor noted there's some concerns in one of those developmental areas, and when you did the ASQ on your first home visit, and it gave you the same data, same kind of concern, it helps you with that process of knowing if you should make that ESD referral or not. So please pay attention to that. Although it's not your primary responsibility, it is your responsibility to be familiar with that and to be working with your family advocate as well. All right. Is there anything else you want to add?
Oh, I do have one more thing that's not necessarily related to Child Plus, but exclusion day is coming up for kids that are not up to date on immunizations. So I have that list. I'll be getting it out to you shortly. Each student will be contacted by the county health department. I've gone through alerts. Every child that's complete, should be up to date. So there's only the ones that are incomplete, should be getting reached out to. But just working with, again, like Bobby mentioned, that partnership with your family advocate, health resource specialist, and helping the family get these immunizations so that they can attend. Because anyone that is not completely up to date on their immunizations by that date will not be able to attend class. That's my last thing.
All right, guys, so let's go to the next tab in your child file under family development. Some of your tabs might say social services. And so there's your face sheet, just like all your other components have a face sheet, which I like to think of as a table of contents when you're organizing your hard copy file.
Bobby, do you have a copy you can show them of what face sheet they should be using?
I
'Cause
don't.
even the file I have has the checklist.
Okay, so there's a little bit of confusion because there's a couple of face sheets that have gone out to staff. The face sheet that we're using, the title of the face sheet should be Family Development Summary of Services. And so when Tegan, Catherine, myself, and ed managers are going out to help you guys with these files, we'll clarify that because there is some confusion on that, which face sheet to use. But I don't want to get bogged down on that right now. So on your family development summary of services, you're going to put the child's name, the recruitment notes, that's going to be the date that the notes were reviewed. All right, so this would be done by the teacher or the CFA because obviously the family, well, and the family advocate too, if the family advocate didn't do the actual recruitment. All those recruitment notes should always be reviewed by everybody. You guys are going to glean a lot of information as to how that family qualified for services in the recruitment notes. Then we're going to do the family story. The initial date is the date that you did the family story and the end of the year, your final score on that family story as well. Then you're going to document when the family goal was developed and written, or if the family declined those services. And then you're going to use a refusal form for that, and that'll go in this file as well. Something about the refusal statement. So when a family, shares with the family advocate or the CFA that, they're really not interested in doing social services, we're going to complete that document of refusal form, but we're not just going to say that's the end all. We're going to follow up with that family every month, because oftentimes what might happen is, sometimes families, emergencies come up, they can't pay their power bill, they've got an eviction notice. That would be a good time to say, hey, maybe we need to revisit me coming and doing some home visits, and I can help you with that and give you resources. On that refusal form, which I don't have a copy of, but we will get that to you, there is a spot where you're going to document that you have spoke with the family and followed up with the family every month. So even though the family declines a family story and they don't want to work on a goal, your job as a family advocate and a CFA does not end there. You're still following up with that family to make sure that their needs are met. If there's anything that they need help, support, resources, or somebody just to talk to. Okay. So Child Plus, the next entry is Child Plus Family Services. So we're in Family Services right now. We have the events page. Jesse in a little bit will go over that with you on how to add your events. But we're going to go to Family Outcomes. Okay, and here is where you're going to enter the scores. Let me see. We can bring up, let's see if Johnny had an assessment last year. Nope. No. Okay, so that's when you enter in your scores, that's what that is going to look like. So on another note, I know it used to be that we did 3 home visits a year for social services. So that changed last year. We are asking that all families receive 2 social service home visits. And the reason for that is because some families and, family advocates, CFAs can attest to this. You're doing more than 3 home visits a year with some of your families. And we know that takes a lot of time. And so we really wanted to make a priority. So based on need of the family is how often you're going to home visit them. So you're going to do it a minimal of 2 times a year. But if you have, like, if the family, has a very high score on their family story, their needs and assessment, you're probably going to want to visit them more often and follow. You naturally will home visit them more often and follow up with them. And by home visits, it does, you should probably be in their home 3 times a year once we're allowed to resume regular home visiting. But when you have a high needs, when those scores are high and this family, man, they just need a lot of support, you're going to be you're going to contact that family more often, making more contact with that family. And all of that hard work that you guys do, it's going to get documented in progress notes. And we'll talk about that in a little bit. So emergent needs, I just kind of touched on that. That's your next point. So, a family's power got shut off and they need help. This is where you're going to document that and the follow-up. And again, all of that information is going to go into Child Plus. For you enhanced day teachers and you early Head Start teachers, this is the other piece where the family advocates and the teachers really need to be on the same page and working together. It's going to help that teacher understand in the classroom why that kiddo, you might see some behaviors, because as you know, if the parent's under a lot of stress, what happens? You see that in the classroom in behaviors. So it's really important that the teacher is aware of that too. And that might just be the family advocate, popping their head in the door and say, hey, can we meet after class? I need to, share some information with you and whatnot. A lot of times the parent will share that with you as a teacher. But, if they don't, it's really important that you guys are working together and everybody has the same information. That's another reason why it's essential. All of that information goes into progress notes. All right. Parent education support group participation. So when you get those flyers from Mary Lou and those family advocates are at home visits and the family might want to share, hey, I really want to buy a home, but my budget, I have bad credit. That would be a fantastic time to refer them to Mary Lou and say, well, actually, we offer some financial assistance classes. If those families participate in Mary Lou's classes, you're going to document that on the face sheet. And then again, you're going to document that in progress notes. Yep, I can talk about that as well. So parent meeting attendance. So this is where if the family attends the parent meeting, you're going to put the date on that, or you can check it. Going through file reviews, we noticed that folks were a little bit confused on that they were marking that it was done. And I think the confusion is if you offer a parent active or a parent night, you guys have family night, people were marking that as done. This is for attendance. So if the family attended, you would mark that. So for example, if you guys didn't have a family center fun night in December, that would be left blank. And then these are your home visits and your contacts, just so we talked about before. Every time you're reaching out to the family, every time you're contacting that family, this is where you document that. It should be monthly, a minimal of monthly. We should see documentation in there. And then again, that documentation is going to go into progress notes. Right. Let's see, family services information. We'll skip that. So down here, this is kind of a little off track a little bit, but over here, you will see the ICS tab, intensive case services. These are those kiddos in the classroom that rise to the level of, some behaviors that are concerning. Yep, or a medical condition, a protocol. Let's see, bring up little Johnny's here. This is where you are going to complete your ICS form. Again, this is a partnership between the teacher, the family advocate, and the ed manager. All right. Once this is completed, this goes to the ICS team, and that ICS team meets monthly because we want to take approach as a wraparound services for these families. What kind of supports can we offer? Do we need to reach out to our community partners and get some support for this family? It helps us develop a plan to best help this family. And then, like if you do an ICS, once again, all of that will get tracked into progress notes. Let's see, what else have we completed? So PIR update complete. So that's the responsibility of the family advocate. So all the way over here, you're going to find your PIR. Program information report. All right, this is really, really essential that this gets completed. This is our data tracking system, and this is what we show the feds, the federal regional office on how we met the needs of the family. This is our data collecting system. So it's really imperative that this gets documented. It's followed up on, that that family advocates are actually inputting into the PIR. So like, for example, during the program year, you have a family that becomes homeless. You would need to go in here and change that to a yes. This is the stuff that we try. When you see the little red PIR, this is the stuff that we're collecting data on. All right. A lot of this stuff will already be completed because we have this information from recruitments when we do the recruitment with the family. But let's say you're a family advocate or you're a teacher or a CFA and the family wasn't on WIC and you referred them to WIC and they got enrolled into that program, you need to change that as well. All right. And again, I know that we're giving a lot of information. It might seem overwhelming. Just please know that we're here to help, that this is just information that we're sharing that needs to be done. And we're going to do our best to support you guys on all of this as well. All right. So now we're going to go to progress notes. All right. And so to get to progress notes, I'm going to do an application. And then right here is your progress notes. These are some sample progress notes that we've done. But I want to take you step by step on what that's going to look like. So there's a method, and probably for you family advocates or social service medical folks, you probably are aware of what SOAP is. It's probably one of the oldest ways to document progress notes. I'm not going to spend a lot of time on SOAP. Family, I'm going to send out some handouts. So so ed managers can go over what SOAP is and what it looks like. SOAP is an acronym. So SOAP is S is subjective. So like subjective, it might be Johnny arrived at class and he was really mad. So it's subjective because we don't know what really mad means, right? Objective, that is just like, think of like it's state the facts. You are detailing exactly what you saw. Johnny walked into the classroom. He threw his backpack across the room and knocked over a chair. That's subjective. Mad is kind of ambiguous. We could define mad in a lot of ways. So, and objective kind of gives you action to that. It describes what you saw. A is for assessment. So like what you assessed, or maybe if you did an assessment like your ASQ and all of that, that's assessment. And P is for plan. What's the plan and what's the follow-up and what are the dates for that plan? All right. So let's just start. Let's just pretend like you got a brand new kiddo enrolled in class, right? You're gonna go to progress notes. You're gonna enter the date, which is today. And then you can see there's some component codes. Because a lot of times it might cover two components. So the component codes are what's in your file, your hard copy file, social services, education, childcare, what have you. So you're gonna do the drop-down box. And so this kiddo just started. So I'm gonna click on enrollment, all right? And then I'm going to timestamp. And this is a piece that a lot of people are missing. So to timestamp something, you have this little icon of a clock. You're just going to click on that, okay? And then, so I'm a new teacher. I got his file. I reviewed recruitment notes. Okay, noted the family is homeless, right? I will follow up with the family on, I don't know, maybe February 1st. At home visit to offer resources and support, something like that. When you do, oops, sorry about the typos, but anyway, when you review the recruitment notes, it might not be anything that stands out, just document reviewed recruitment notes, just so we know that you did it, okay? And then you're gonna find your name there. This is Pagan, I suppose. Anyway, find your name, and click on it. sorry. There you are. And then you're gonna save that progress note. All right. So let's go back to add progress notes. Let's say February rolls around, you did that first home visit. If you're CFA, it's going to be education, social services, might even be health. You're going to timestamp it again, and you're going to document completed first home visit with family or with mom, with Sally, I think is Johnny's mom's name. Completed ASQ. We'll just start with ASQ. And noted concern with maybe, let's say like with communication, because that's a pretty common one with families. Mom shared concern. She thinks Johnny has a hard time listening, right? And then so you can, if you know, you could type in, will follow up after health staff complete the hearing screen. So basically what's happening is progress notes is a narrative of that family and that child of what's happening. You're gonna again enter your name. You're always gonna timestamp your progress notes. You're always gonna say, let's say they come out, health folks come out, they do their evaluation. Johnny received hearing screen and failed. Shared copy with parent, referred parent to follow up with medical provider. All right, and then your name, and then say, whoops, what did I do wrong? And say, please enter a value date. Let's say that happened on whatever, the 19th. There we go. All right, so then go back to add progress notes. So the family advocate does a home visit with the family. So we'll just pretend like they did that sometime in February. Social services, a family advocate is very much aware that that kiddo failed their hearing evaluation, their hearing screen. The advocate is going to discuss that in progress notes. Completed a first social service home visit, completed a family story. Please see family story in the file for more information. Family noted that they would like to buy a home after credit. Family would like this, their goal to buy a home. Refer family to upcoming, parent ed and budgeting. Review the results of the screening evaluation. Parent shared that, Johnny has a doctor's appointment on such and such date. We'll follow up with parent after the child is sent to get more information. So that's the kind of documentation that you're doing in progress notes. It's basically, like I said before, it's a narrative, it's a story, it's giving you the whole picture of the entire family. So teachers are documenting the progress for the education component. Family advocates, you're documenting on what you're doing with the family story, with health. It's a joint effort between the teacher and the family advocate regarding attendance plans. You guys are both on the same page with that. If you guys open up an ICS case for that kiddo, that's going to get documented in progress notes, always with a timestamp. So what's going to happen? So what happens, there's two things with why progress notes are so important. As you guys know, in anything that has to do with the government, if it's not written down, if it's not documented, it didn't happen. We all know how hard you work. We know that this work is getting done. This is how I'm going to show them that this is getting done. The other thing is like, for example, you guys might reach out to me with a kiddo with a disability concern. And you send me an email and you say, hey, Bobby, Johnny, I think there's something wrong with the speech. Can you please, refer him to ESD and all of that. There's a whole process about referring a kiddo to ESD. But what first thing I'm always going to do is I'm going to pull up those progress notes so I don't have to go component by component by component, nor do I have to have that hard copy of the file. The relevant information that I need to know is going to be in progress notes. When the ICS team comes together to discuss a kiddo that you guys have opened a case on, or maybe a family advocate has opened a case on, or a health person, we have to go to progress notes. And we're going to see if the teacher has this concern with this kiddo. She's documented her concerns and what she's done in the classroom to assist that kiddo. And then the plan is going to be documented in there as well. I know, again, it's overwhelming. This is probably new to a lot of you. Just know that we're going to support you. This is a progress. Learning how to SOAP and do progress notes is challenging. It's difficult, but we're here to assist you and help you with that. By no means you need to write progress notes, just highlight what you've done. All right. Please, once again, if you have any questions, stick them right there in that chat box, and we're going to get back to you on that as well. Once again, you also have education managers. You have myself, you have Sarah, you have Katie, Jesse, Mary Lou, all of us, all of these component pieces we can help you guys with. All right. All right. Is there anything else we need to add?
For family services.
Yep, for family services. Yeah, all right, now I'm gonna turn this over to Jesse about events.
What I can do is for